1/3 of the people living in New York's borough of the Bronx have COVID-19 antibodies. It's the first time a U.S. municipality has released data of this kind, and it's hoped that the information can help the city develop more effective public health strategies. William Denslow reports.
The data compiled from nearly 1.5 million COVID-19 antibody test results from New Yorkers across the city shows that across the 5 boroughs of New York, it was Bronx residents that had the highest level of antibodies, up at 33%. That's compared to Manhattanites that had the lowest levels, down at 19%. But if we drill closer into these figures, what we see is that these numbers fluctuate dramatically within boroughs. Looking at a part of Queens, in Corona, Queens, we saw that in one particular community, more than half of that population tested positive for coronavirus antibodies. The data also showing that children under 17 had the highest percentage rate of antibodies, but that was the smallest sample size. Now, much is still unclear about the effectiveness of antibodies in protecting people from the virus and indeed how long they last. But the message from epidemiologists is that this kind of data could also help raise questions about herd immunity in cities like New York that have been hit so hard by the coronavirus.
Should we find out that antibodies suggest immunity, then we would be when we were planning, we would say, okay, well, Queens has 50%. That's probably not quite at herd immunity levels. However, they're farther along to herd immunity, say, than someplace like Manhattan, which I think the estimates are around 19%. So that has implications for how we might roll out testing. If a vaccine becomes available, it might have implications for how we roll out vaccine.
COVID-19 infection rates across New York State have fallen below 1%, but officials urge residents to remain vigilant and keep complying with public health guidelines. And the message from officials here in New York City is that they hope to use this antibody data to help create strategies going forward that they hope will make the city safer. William Denslow, CNA, New York.